Dr. Huebner here, Natural Transplants, and I'm here with our superstar Tanya. And a lot of people have been watching Tanya's videos from the very beginning when she had her surgery day to her 5 month. Was it 5 months or 7 months? I think we had
4 months.
4 months, yeah, and then a 7 month.
7 months.
Or something, and now it's a year. So this is her latest video at a year, her final result. Tanya, tell us about your hair. How do you feel about it? How's your life been?
It's been great. I love my hair. You know, nobody knows I did this, so
yeah.
Nobody can say like, hey, your hair's growing in. So no, everybody just always says I have really pretty hair.
Good.
So nobody knows.
Yeah.
A lot of the young ladies call me when they want to ask questions and talk to me and things like that. But other than that, no one knows about it.
Yep. Okay, good. So it looks natural. No one's saying that looks unnatural.
Right.
No one nobody even knew you looked like that before, and they think you have normal hair.
That's correct.
Perfect.
Yeah, the only people that know is my YouTube haters and lovers.
Yeah, there's a lot of haters out there and a lot of lovers out there. So, yeah. But you're certainly.
I appreciate you both. I like both of you. It doesn't matter to me.
Yeah.
Me and Dr. Matt was talking, and we're gonna answer some of your questions because
yes.
We get a lot of YouTube hits. I guess my ad pops up at a lot of places, so
yeah.
He can't answer all of your questions because he doesn't have my hair.
Yep.
A lot of you young ladies want to know if you can get a relaxer. First, I want to say I don't do anything unless the doc tells me to. Before I do something, I call him first because.
Right.
You know, you girls are thinking with my ponytail. You were saying I'm gonna take my hair back out. I'm gonna take my edges back out. Ponytails don't take out edges.
Nope.
Number one. Number two, if you were listening to my video, I was explaining that my hair was not pulled back in the ponytail. Not my, my transplanted hair.
Right.
It was just laid down.
Right.
It was not any tension on that part.
Right.
She just sprayed it and laid it down. The type of hair texture I have, I can do that.
Yeah.
A lot of people can't, but I can. So
yeah.
no, I was not putting any traction on my hair.
Yeah.
So if you get this procedure, remember, don't do anything that's gonna pull it on a constant basis.
Right.
I told him, Dr. Matt, we talk all the time, and he was explaining to me that anything I do, I need to do it in moderation.
Yep.
But don't do anything that I'm like, pulling.
Yep.
So that's common sense.
Yep.
I would never do that. I didn't do this and come this far to take my hair back out.
I agree. Yes, absolutely. How does it look on the other side there, Tanya? Just for your viewers, maybe we could show.
So listen, let me show you guys how long it's.
Yep.
This is
so that's all new transplanted hair. Yep.
Okay, and so you can see that.
Yep.
I don't know how good it's gonna show, but my hair, guys, my hair was long, so if I can do anything and it just blends right in. See?
Right. Yeah.
So see, I just blended that short part back in it. Your hair grows like a couple of inches a month or whatever. So remember, it was gone.
Yep.
So this right here is just my hair brushed back. Now that my hair is a certain length, I can brush it back.
Yep.
You know what I'm saying?
Yep.
I can brush it back.
And look at that edge. Now you have the sideburn there. That wasn't there before. That's all recreated.
No,
yep.
none of
that was there.
Yeah. If you guys remember, all of this was gone.
It was all gone. Your forehead was twice the size. You were,
Yeah.
It affected you.
Yeah. And, some of you think that my hairline looks fake. I promise on everything. This is my hairline. Dr. Matt didn't make me one.
No. That's your old hairline.
Right. Back in the day, I have an apple head, guys. It's a round circle. So my hairline, literally the way God made me, this is my hairline. He just took it and because remember, I had a little bit of hair, so he was able to see where to put it.
The remnants of your old hairline were there, so we could see exactly where it was. Yep. So but not to say you couldn't lower it anywhere you wanted to, but that's natural. That's as natural as it gets. That location. Which comes to my next. Me and him talked for a while. A lot of you guys are asking, can he lower the hairlines? I said it last time, but he can. He literally asked me if I wanted it lowered, if I wanted my hairline changed, and I told him no, I want my natural hairline because I didn't know what it was gonna be. Right.
But as you can see, what he did, he is awesome. because look, he blended. You see how the part was short, but look, you can't even tell.
Yep.
I just have my hair in this style. This is the style I wanted to wear this week.
Yep. Awesome. What other questions are you getting? Anything else you want to answer on the video?
Yes, I'm gonna disappoint most of you probably because you were begging me not to get a relaxer, but guess what? I got one. I know my haters are gonna go crazy. But a lot of ladies was asking, can they get a relaxer? So again, I asked my doctor, and he told me I didn't even have to wait the year. But guys, I just got the relaxer last week. My year was up on the 28th. Yeah. But I'm gonna tell you, I'm in Jacksonville, Florida, and it is hot as fish grease here. Okay? And it's really humid. In the afternoon, it rains, so it was really hard for me to take care of my hair, like what I do for a living, the certain look that I had. I couldn't do it without a relaxer. So that's why I did it. My hair is still nice and healthy. Yep. I know how to take care of my hair. A lot of you think I do know how to take care of my hair. The years of the braids were over. And I seen some of you arguing about the braid thing to each other. As you keep wearing braids, your hair gets thinner in the nape areas. Yep. It gets thinner. Yep. And if you don't stop, you will have tractional alopecia. Again, to make myself clear, I'm 40. That's how old I am. I was wearing braids in my 20s, all in my 20s. Yep. It's like I just was cocky, like, oh, my hair go back. When I saw it thinning, and then I have identical triplets, and I was 33, and I had got these micro braids, and I was wearing them the whole pregnancy. I was so lazy, I didn't want to do my hair, and when I took those micro braids out, my hair was like, bye-bye, that's it, I've had it. So that's when it started getting like you couldn't, I didn't even realize it pushed it back, and this it fell out. Yep. I stopped getting relaxers because I thought that, but and I started going to dermatologists, and I was doing all kind of stuff, rubbing things on. But once those hair follicles are dead, it's gone. It's dead. You can't do anything about it. Another question Dr. Matt asked me to address was, you girls are asking about if your hair is falling out in an area, can he transplant the hair, and if so, will it fall out? The answer is no, because listen, this part of your hair is one genetic trait, gene, whatever. The back of your hair is a different genetic. That's why a lot of men lose their hair in the front, and they have hair in the back. So when he takes that hair out of the back and puts it in the front, it's a completely different genetic. So you can't, your skin, the pulp that he puts in, it grows out of that. Right. So I know it's hard to understand, but a lot of phone calls I've gotten, they ask me that, like, well, isn't your hair going to just fall right back out? Right. And that's not the case. The reason why I know, because I researched it, and then I got my good doc here, because of the number of views we're getting and the questions, like, he has to teach me how to answer your questions and show me what it means. So when young ladies are calling me from all over the world, they're like, I don't get how that works. And what it is, he literally puts a completely different genetic hair graft from the back to the front, and your hair starts growing out of it. So now, like, this hair right here is not the same hair texture as it was before. This hair is now the hair texture that is back here. So it's thicker.
It's the same hair. All you're doing is moving it from the back to the front, and that hair is resistant to any genetic changes that you may have. Because a lot of people not only have traction alopecia, they have kind of thinness up top because it runs in their family. So by taking it from the back, you're basically solving both problems. You're putting that there, and that's there for good. So even when you're older, it'll still be the same thickness. So
And think about it like this. Remember how he's saying he can change your hairline? You don't grow hair on your forehead. So by him changing your hairline and that hair is growing like that, it doesn't matter. It's because he put it inside, and that's what it's growing out of. So hopefully I've answered that. I've answered the ponytail question. I answered the relaxer question. So yes, young ladies, you can get a relaxer. Try not to get it within the first 6 months. Even the doc said I could, but you know, from my experience, I'm gonna tell you this: your hair is still growing and adapting, and like it doesn't all grow at the same time. Like it's growing, but you still, like right now, Doc told me that 6 months from now, it'll still be some growing. That's not growing now. I still might get a certain percentage, probably within another, 6 months to a year or something like that.
Yep.
It's constantly growing. So just try to wait it out. You know what I'm saying? To kind of see.
Natural is the best way. Natural is the best way to go. So less is more sometimes. So
yeah, it's just where I live. I think if I was up somewhere where it was always, medium temperature, that I could have made it, but constantly getting a blowout and that's just damaging. So I'm the type of person, I go to the stylist every week because of this weather and stuff, things like that. And my stylist, she takes care of my hair. And so, I'm confident that I'll be fine. But I just wanted to answer those questions. Me and the doc were looking at all the YouTube comments and things like that, and we talked about me answering some of the questions. Oh yeah. You guys have been asking about that suture, the cut. You can't even see first of all, I don't have keloid skin, so that's
important. Right.
So because I don't have keloid skin, my stylist, she can't even find my cut. It's almost like it has disappeared. Seriously. Yeah. I had my husband digging through it. He was like, man, you will only see my cut if I probably shave bald. Because the line is like completely, I don't know how he did that.
Years of experience. That's how you do that. So but it's not an issue for you. It's not like you're losing any hair in the back. It doesn't make any difference. Right.
No. Oh, someone, one of the young ladies, I have a lot of women that call me, so I won't say any names, but one of them asked me about the hair growth in the back and the hair growth in the front. Yes, the hair growth in the back is faster. Like my back part is like this long already. Where he shaved it, you can't see any, it just looks like my hair, you can't see like a line. Right. She asked me if you could see, you can't tell anything. It's just, you can't tell at all. And it grows quicker in the back. For me, that's the way my hair grows. My hair in the back grows quicker. So it, like I said, it's long in the back. It's almost this much to where my real length is. And the front, yes, it's growing slower, but it's growing. Like my stylist is like, oh my gosh, it's growing so fast, because remember it was bald. And when he started it over, it had to break through the skin and start growing. So, but as you can see, you can't even tell it is shorter because how the hair is just blending very well. I didn't want to wear it all back, so I wanted you guys to be able to see that you can wear your hair. I can do whatever I want to it now. So
and importantly, you can bring it back in a ponytail. So you can do whatever you want. You're back to where you were before. So awesome. So a
lot of you wanted to see what it looks like after a year. It does. And again, I'm going to show you. The doctor told me to make sure I'm showing you what. And remember, I have a relaxer, so this is amazing to me. It didn't thin it. Right. It didn't make me look like I had little. No, it's perfect. So
that looks great.
He wanted you to see, and this, I just have this brush back and tucked right here. So that's it with that.
Cool. Well, thank you so much, Tanya. This has been very informative, and you have a lot of fans now. And I'm going to put some pictures on there, too. I'm going to see if Tanya can maybe send us some pictures we can put on there as well so you can see a little better. But
I'll take some.
Awesome. Thank you so much, Tanya. And, I think maybe in the future, every once in a while, we'll maybe address some questions people are asking you on YouTube and whatnot.
Oh, definitely.
It maybe easier to do it in this format. So
me and the doc made a pact. See, he said as long as you guys keep asking questions and showing, he'll call me up and I'll answer the questions. I'm sorry if I didn't. It was so many questions, but those are like the main ones. You guys, I promise you I'm not going to take my hair out.
Well, we'll be following you up to see. So awesome. All right, Tanya, thank you so much.
Bye, hon. Thank you. Talk to you later.
You got it.
Okay, bye-bye.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.